All right, welcome back to the Living Life Well show. So, today we're starting a series called What Should I Eat? And we're going to start that series focused on diabetes. Then we're going to move to thyroid, and then we're going to move to your gut because they're all slightly different. And the reasons for eating the certain foods are going to be a little bit different as well. However, as you will find as you listen to this, there's going to be a lot of overlap. Well, where did this idea even come from? Well, honestly, this is one of the most searched items on ChatGPT, really trying to determine what is going to be healthy, what is going to be best. And so some of the questions that are associated with that is like, what's the best breakfast for diabetics, low carb, fast food options? Can diabetics eat fruit? And so these are the first three questions that I want to start with. And looking at that, what really is going to be for breakfast? Well, the big thing and the thing that tends to help the most is to start your day with quality, number one. So quality ingredients and quality foods, no matter the category, whether you're talking about carbs, fats, or protein. We want to make sure that we're always utilizing quality foods, quality ingredients. So the big thing to avoid for breakfast is going to be the cereal. The cereal is going to be carb laden. It's generally speaking full of artificial flavors and colors, and of course, sugar. There's no protein value in it. There's sometimes fiber value depending upon which one you use, but by and large, there is very, very little nutritional value. So when we're looking at breakfast, where we want to land is going to be primarily in protein and then greens. And those are going to be the two categories. So for protein, we could be talking eggs, we could be talking meats, we could be talking nuts and seeds and getting fat and protein in that way. And then greens. So, think of that green omelet or potentially even maybe a green smoothie. Things like this are going to be very beneficial for diabetics. Now, I'm going to skip over the low-carb fast food options and go to can diabetics eat fruit? Absolutely, diabetics can eat fruit. Now, you've probably heard me speak in the past about the glycemic index, talking about the different levels of fruit, and really needing to look at a couple of different things. But primarily what you're wanting to focus on is serving size as it relates to that glycemic index or the fructose chart, I should say. And so when you're looking at that, you really want to pay attention. Now, berries are very, very good. Berries in general tend to be a little bit lower on the fructose chart when you control for serving size. We've discussed this in the past that a serving size of a pineapple is like a single ring that you get out of a can, or even if you just chop through it, maybe a decent sized chunk. But that's it. I know myself personally, when I've eaten a pineapple, I can't stop with just one of those rings. It's going to be 3 or 4 of those at a minimum. And so when they establish the serving size on this fructose chart, the serving size isn't necessarily what you're actually going to eat. The other aspect of that is blueberries. Blueberries are fairly higher to the right on that fructose chart. However, when you control it for serving size, it's an entire cup of blueberries. Very rarely are you going to eat that many blueberries in one setting. So absolutely, fruits are very good. Fruits can be a good way to start your day. However, typically what you want to do when you are eating any meal is you want to start with the lowest glycemic or fructose containing foods first, and then back into those others. Now, when it comes to fruit specifically, a lot of people talk about fruit juices and all these types of things, or fruit extracts. However, the problem with those is they remove all the fiber. When the fiber is removed, fruit can be, unfortunately, something that is less beneficial and even deleterious to diabetics, because that fiber control has been removed. That fiber that helps control the rise of the glucose as well as the speed with which it rises is out of control once we start juicing or doing an extract of some sort. So for breakfast, you want to start with proteins. You want to add in greens and then top off with fruit towards the end. And so that's going to be typically how we're going to recommend that you're going to eat. You want to start with your fiber-containing foods and proteins first, then move on to the more carb-heavy foods towards the end. That does a couple of things. One, it allows that fiber to get in there ahead of the glucose so that that glucose doesn't rise so much. Two is it also creates an environment for satiety, meaning you're not going to want to eat as much carbs as you would as if you started with carbs at first. So, couple of different things that we can do there just for breakfast and eating meals in general. So that goes to the next question: low carb fast food options. Well, really what you're talking about is virtually all of the different types of restaurants, whether it be a burger place, a chicken place, a Mexican food place, a kind of drive-through situation where you're talking about fast foods, means that you're going to remove the covering. You're going to remove the tortilla if you're talking about, someplace like a Taco Villa or Taco Bell or, even Chipotle. You're going to remove that. You're also going to remove the bun. You're going to go bunless when you go to your fast food drive-through for the chicken or for the burger. These are going to be the two big things. The next thing that you could do are really going to be looking at salads, and salads are going to be important as well. Whether, again, you're going to Chipotle, a Mexican food place, look at the taco salad, the quote burrito bowl, and those are going to be options that are better. Again, avoiding those things that tend to spike sugars. At Chipotle, substitute, if you're going to do any, do brown rice instead of white rice if you're going to do rice. Go light on the rice. But load up on the greens, load up on the grilled veggies, load up on the lettuce that is available to you. And these will help to offset any of those carbs that are there. Now, is this the best lettuce? Is this the best? No. When you're in a pinch, will it suffice? Yes. It will help to keep that blood sugar from spiking quite as much. If you're really leaning into the protein aspect, you could go double protein if you wanted to, whether it be chicken, whether it be beef, and do those things. Now, when you're going through the fast food line at a burger joint, it can be a little bit more difficult because those burger joints typically are going to have less useful sides than typically going through, like say, a chicken place or something like that. When you are looking at the burger joint, if they have a side salad, great. Wendy's is a great place that you could do this. If you're craving a burger more, you can leave off the bun. You can get a side salad as opposed to fries. If you're going to some of the other burger places, that may be a little bit more difficult. And in that case, I would recommend leaning more into protein than really side. So maybe you do a double meat burger as opposed to adding fries or something like that. And then when you are going to the chicken place, if it is not the chicken sandwich place, and you're looking more for chicken strips, really go grilled instead of fried. Yes, the oils and those things aren't going to be as beneficial, but the breading that is going to be associated with those chicken fingers or chicken strips is going to be what you're really going to see that will spike. So go for the salad with the grilled, and you're going to be way ahead of the game. Then that brings us to, what are you going to top it with? Well, avoid ketchup. Ketchup is going to be the thing that has the most sugar in it, most likely to spike your blood sugar as well. This is the big issue. Many of the condiments, be it things like ketchup or mayonnaise, can be more or just as deleterious to us as sometimes the carb blanket it's wrapped in. So we really want to make sure that we eliminate those extra little areas that are going to really spike our sugar. And the condiments are going to be really, really big on this. This goes along with salad dressings as well. So typically, if you can get an olive oil or a balsamic, you're going to be less on that sugar level there than if you did something like a ranch or even maybe a creamy Italian and those types of things. So look at that for an option as you go through, or just leave it off. So now that kind of brings us to snacks, okay? What are the best snacks to avoid glucose spikes? So really what we're talking about here is we obviously want to avoid carbs, right? That's inherent, I think, in this question. So what foods are best going to help you do that? Well, one way would be to really lean into protein, right? So you're talking things like really beef jerky is going to be really good. And then looking at nuts and seeds. These not only are going to help to avoid spikes because they are lower in carbs, but they also have a lot of mineral benefits that we don't necessarily get from other sources of food. So really looking at doing, true nuts, not looking at a granola mix or anything like that, but just true raw nuts are going to be the big things. Things like pumpkin seeds, sunflower seeds, looking at almonds, walnuts, cashews even. Peanuts are going to be the one nut we would want to limit a little bit more. But otherwise, those are going to be some good value add snacks. Now, some of the other questions on here with regards to food for diabetics or, a meal plan for A1C reduction. This is great. So again, those principles where you want to go carbs at the end of the meal are going to allow to help with that. But protein is going to be important along with high fiber content. These are going to be the two things that you want to look for whenever you're planning your meals. You want to look for foods with high fiber. Well, what typically has high fiber? You guessed it, green leafy veggies are going to be the things that have a minimum amount of carbs and more fiber. So starting your meal with this and with the protein, then moving into the carbs at the end, be it bread, be it fruit, be it really anything else, that is going to be a meal plan in general without getting specific about foods that will really help you. Now, in my metabolic reset course, this is one of the things that we really focus on is we get into meal planning and we allow for those meal plans to really help people determine, okay, this really does help. And the protein versus carbs impact on glucose, typically many of the things that we buy that are in containers, be it a can or a package, a box, something like that, that says high protein, still a lot of carbs in it. When you eat, beef or chicken, there's still some carbs in there, but much, much different than eating a packaged item. So the protein versus carbs impact on glucose. Carbs are always going to have a much more impact on your glucose for not only that single meal, but also the rest of the day than protein will in general. And so protein is going to be much less impactful on the carbs. It will impact it. All of them are going to cause your blood sugar to increase. However, when you are on a carb-heavy meal, then you're going to obviously see that impact much more. And then there was a question about, continuous glucose monitor meal interpretation. Now, this is a great thing because the continuous glucose monitors are really, really good about being able to, quote, predict how you're going to respond to a meal. And this is really good information for people to look at. And so when we look at how it impacts a meal, we want to look at that initial impact, the hour to 2 hours after the meal, and then how quickly does it return to baseline? Most all of the apps now, be it a Sotelo, be it the Dexcom, be it the Freestyle Libre, and others, have an AI component to it. The AI component generally allows you to take a picture of your meal. It interprets it with some accuracy. Usually it's beneficial if you go in and edit what it says is in the meal. Many times it gets it very close to right. Sometimes it doesn't. And so this is a good way for you to take a picture of your meal and see what it does, but then compare that to other meals. Compare that over time. Take out one or two higher carb containing components of it, and then see what that same meal with just that slight switch does for your blood sugar over time. So I really love this aspect of the continuous glucose monitors because it allows you not only to depend on what it says the impact is going to be, but see what the actual impact is for yourself. You're only going to get this and really be able to go back and look at that data if you do that AI component and take that picture. So that's going to be really big. So now some specific foods that people look at. Oatmeal. Oatmeal can be okay. However, you really have to have that protein first before you start the oatmeal and or a lot of fiber. The problem with most oatmeals is most of them have some sort of added sugar component, be it apples and cinnamon, be it cinnamon sugar, be it whatever the case. Most oatmeals are going to have added sugar, and so that can be a bit of a difficulty. And or if they add fruit, if it's a pre-prepared oatmeal, sometimes there's more fruit juices and added sugars there. So generally speaking, I recommend you stay away from cereal, stay away from oatmeal for breakfast. Okay, so rice and potatoes, okay? In general, not a good idea, right? Very high in carbs. The best rice to get would be black rice. Next would be brown rice. Worst is going to be white rice, okay? Same things with potatoes. Best are going to be those Dutch potatoes, that they're purple on the inside potatoes. Then it's going to be looking at sweet potatoes. And then finally, white potatoes, new potatoes, russet potatoes. Those are going to be the absolute things that you're going to want to stay away from. Now, I don't recommend rice or potatoes really at all when starting out with that A1C reduction. We want to bring that A1C down quickly, and the rice and the potatoes are going to inhibit that. Even the best ones. And so we want to minimize rice and potatoes at the beginning for sure until we get that A1C down enough so that we can really kind of understand where we're going with it. Now, sourdough bread. This is kind of a loaded question. Sourdough bread in theory could be okay. However, in general, most grains, when you're first starting out with diabetes and looking to bring down that A1C, you want to avoid. However, if you're doing any bread, whether it's sourdough or any other type of bread, really what you want is you want it to be truly, truly whole grain, like we've talked about before. That's going to be something that is very important. If it's not whole grain, if it has the additives in it, that's going to be the issue. Typically, store-bought sourdough bread. Now, when we're talking bread, really for diabetics, pretty much you're going to have to make your own bread, okay? And then berries. Berries is a big question on here. We've discussed that, really looking at that fructose chart. Same thing with the banana. That serving size for a banana is like half of a medium banana. And so that may be very difficult. That seems like a small amount. If you're going to eat a banana, generally you're going to eat a banana, the entire thing. And so what's a medium banana? What is a large banana? A small banana? And so in general, bananas, I would say, are going to need to be avoided because they do tend to spike the blood sugar. Alcohol as well, same reason, will spike the blood sugar, keep it up. In addition, it's going to be inflammatory, which is going to continue to keep that blood sugar up even if you are drinking alcohol that maybe has lower sugar content, like a very dry red wine or something like that. Artificial sweeteners, same thing. In and of themselves, they don't spike your blood sugar. However, they can help enhance insulin resistance because your body may still secrete insulin in response to you eating them. In addition, we know that artificial sweeteners cause a lot of inflammation in the gut, which also leads to issues with blood sugar and insulin resistance. So these are just a few of the things that we see coming through ChatGPT recently as to questions about, food, what should I eat with regards to insulin resistance. These are all going to be things that really need to be individualized to the person, the amounts, the frequency, but the general principles are when you're eating, you want to start with fiber first, protein second, carbs last. If you eat in this manner, then you're going to be more successful with getting that A1C down. You're going to be more successful with weight loss. You're going to be more successful with getting off of those diabetic meds. So if nothing else, I would just suggest try that. Try the fiber first, try the greens first, try then the protein, then going to the carbs, and just see what your blood sugar does. Get that continuous glucose monitor. Ask your physician about it. If you're not Medicare, it's a lot easier to get in many cases than if you are. But even if you are Medicare age, I would still investigate it. It's worth the $50 to $90 to have this information that really can be extremely impactful for you because the things that you think may be healthy may not be really good for you right now. And so this is part of the process that we go through with the metabolic reset. And so I encourage you, if you know somebody that's diabetic, if you know somebody that's struggling to lose weight, control their A1C, get off medications, having difficulty with energy, these are all addressed in this metabolic reset course. And so I would encourage you to share this, to follow us, and let us know if we can help. There's a link to the Metabolic Reset course if you're interested in the show notes here. And thanks and God bless. That's it for this episode of the Living Life Well show. If you like what you've heard and want to learn more or want to know how to put this into practice for yourself, go to livelifewellclinic.com. Until next time, this is Dr. Jon Skelton saying go out and live the truth so you can live life well. The preceding is for entertainment and educational purposes only. It is not meant to be used to prevent, diagnose, treat, or cure any condition. The information contained in this show does not substitute the need for a qualified medical professional, nor is it meant to provide medical advice or services. If you feel information presented in this show may apply to you, we recommend you seek out the help of a qualified medical professional who can evaluate and treat your specific concerns.